Hey everybody, Robert Preston Jr. here with DouglasNow.com. Here with Mayor Tony Paulk. We're at City Hall, and the mayor has some information for us regarding some updates to the curfew and social distancing guidelines and things like that in the wake of the latest updates that we've gotten that now have our number of COVID-19 cases at 10. We feel like we as a community need to do a little bit more to try to encourage social distancing and make sure that we're doing what we can to stop the spread of this disease throughout our community. So, Mr. Mayor, tell us what you got.
Well, first of all, good evening. How you doing? Hey, I appreciate you coming down to City Hall and giving us the opportunity to address our citizens directly and as expeditiously as possible. So basically, I have a prepared statement, and then we're going to talk a little bit, and we'll go from there. So first of all, our community is facing an invisible challenge. The coronavirus is in Coffee County. Our leadership team is committed to navigating our community through this challenging period in our history. The community leadership team consists of representatives from the City of Douglas, City of Ambrose, City of Broxton, City of Nichols, Citizens Christian Academy, Board of Education, Economic Development / the Chamber of Commerce, the Sheriff's Department, Coffee Regional Medical Center, Emergency Operations Center, and the Coffee County Board of Commissioners. Our objective is very clear. The objective is the health and welfare of our community. We meet as needed to discuss the coronavirus. After we pray, Coffee Regional Medical Center gives the leadership team a status report. Next, the leadership team discussed the best course of action to support our hospital and community. We are operating based upon the medical data, and that's all we're operating on is the medical data that's being provided. Our leadership team wants to speak with one voice to our citizens. Everyone is singing Amazing Grace at this point. We meet, discuss the issues, and then we come out and we talk to our citizens. Our pastors in our community have set the perfect example. Worship services were held throughout our community on Sunday. No, it was not worship as usual, but worshiping God took place in our community via parking lot services and Facebook. Pastors did not violate the social distancing guidelines of 6 feet apart and no gathering of 10 people or more. Thank you, pastors. We need your spiritual leadership and prayers more than ever now. Tonight, I want to talk to our citizens about the coronavirus. Currently, Coffee County has 10 confirmed cases. This information is located on the Georgia Public Health Services website. The website updates at 12 noon and 7 p.m., including weekends. I encourage all citizens to visit the website and obtain detailed information about the virus. The community's best defense is to adhere to the social gathering guideline. 6 feet apart means 6 feet apart. This information is the majority of our citizens are complying to social gathering guidelines, but there are a few that are not adhering to the guidelines that put us all at risk. The president has extended the guidelines through April the 30th. 6 feet apart means 6 feet apart. Social distancing interrupts the spread of the virus. We are discussing what is going on in other cities and other states. Our community did not have a spring break, but our younger citizens are having coronavirus parties and hanging out at convenience store parking lots. This must stop. This must stop, and it will stop. Therefore, all children under the age of 18, your curfew now is 7 p.m. to 7 a.m. unless you're in the company of your parents or guardian or you're traveling back and forth to work. The 9 p.m. curfew continues for all adults. A change is all retail stores are ordered to close at 8 p.m. This will allow the workers to get home before the 9 p.m. curfew. I would like to encourage all businesses to introduce what we're calling transactional cleaning. Basically, cleaning the customer space after each customer has been waited on. Numerous citizens want to know about the coronavirus and who has the coronavirus. HIPAA prevents us from sharing this information with the general public. Georgia Public Health interviews everyone that has the coronavirus or potential exposure to the coronavirus for potential contact to other citizens. At this point, Georgia Public Health reaches out to everyone that the patient that has contracted the virus or has been exposed to the virus and asks them detailed questions to make sure if they need to come into the emergency room or come into the walk-in clinic. But please be mindful, if you suspect that you have it or have contacted someone that has it, call first. Call the walk-in clinic or call your physician. Do not just show up at the emergency room. Our biggest challenge is social distancing. I received numerous calls pertaining to two of our larger stores. The city is in discussion with both stores to make the necessary adjustments in the very near future. Please note that the president has identified numerous businesses and industries that are critical to the economy. Therefore, our leadership, we couldn't shut those businesses down if we wanted to. We just don't have the authority. However, the businesses and industries are not exempt from practicing social distancing in the workplace when applicable, and deep cleaning surfaces. No, everybody that's in the workforce cannot be 6 feet apart. But where it is feasible, we are encouraging you to do so in the lunchroom, on your breaks, to maintain that 6 feet. Our hospital needs our assistance. And I need you to understand, what's happening in the larger cities eventually will make its way down here to the small rural city of Douglas and Coffee County. Right now, our hospital is doing fine. The director or CEO, Miss Vicky, says that we're doing well. But we know that the system has the opportunity to be overwhelmed. So basically, the supply levels are okay right now, but the hospital needs to be prepared for the future. If you so, please get in contact with the Douglas Coffee County Parks and Recreation. Yes, the Douglas Parks and Recreation is leading the charge for sewing hospital masks and any additional items that the hospital may require in the near future. Please help us protect our healthcare providers. Our plan is very simple. Number one, we're going to pray. Number two, we're going to pray some more. Number three, stay at home. Number four, stay at home. If you go to the store, please do not take your entire family. One person per household should be going to the store for the entire household. We don't need to take a congregation of the entire family of 7 to go pick up 2 loaves of bread. This will reduce the traffic in our stores. Wash your hands frequently. That's number 6. I'm going to say number 6 again. Wash your hands frequently. Number 7, 6 feet means 6 feet. Coffee County, I am confident in our leadership team. I'm extremely confident in our pastor's leadership. We are all on the same team and everybody has to do their part. If you sow, sow. If you preach, preach. If you pray, pray. 6 feet means 6 feet. God bless our citizens, city, county, state, and nation. At this time, we're going to have a little conversation with Douglas Now. And yes, we're not practicing social distancing.
Well, I think this qualifies as essential. And I want to thank everybody with the city and the county for getting information to us that we've been able to get out to others. In the absence of information is when people speculate, when rumors run wild, when all kinds of crazy stuff happens. And while we are bound by HIPAA and there's certain information that we can't release and we're not going to be able to release, I think everybody's done a good job of getting the information to us. Public Health has done a great job, the hospital has. And again, we're trying to do our part to pass it on to make sure that everybody knows as much as possible. Now, I know that in the wake of these extra cases, because in a week's time, we went from 1 case to 10.
Correct.
It was 1 to 3 to 7 to 8, then to 10. But the span was from Sunday to Sunday. We went from 1 to 10, and we also had 2 consecutive updates, the one yesterday at noon and then the one last night at 7, where we jumped, and that's the first time that's happened.
Correct.
And I was halfway expecting one for there to be a jump today at noon, and there wasn't. And I don't have any information. I just know the way it's been trending, I wouldn't have been surprised. And we're taping this right now about 10 minutes after 6. So in 50 minutes from the time that we're taping this, there's going to be another update. And it could quite possibly be that by the time you see this later on Monday night, that there may be more cases. We certainly hope not. We're praying that that doesn't happen. But in the wake of these extra cases, we are going to have some other additions to our curfew. You mentioned that in the statement, but there's some other parts of the social distancing and our emergency declaration for the county and of course for the city that are out there too. What are a few of those?
Well, basically, what we're doing is we're just modifying the existing emergency order or the local emergency. The first thing is strictly from the order is all retail, restaurant, and commercial stores must close by 8 p.m. Retail stores, grocery, pharmaceutical, and building supplies up to 4,999 feet can have 10 customers at any given moment. From 5,000 feet to 9,999 square feet, stores can have up to 25 customers at any given time. Stores in the capacity of 10,000 to 19,999 square feet, those stores can have up to 50 customers at any given time. 20,000 square feet to 49,999 square feet, those stores can have up to 75 customers at any given time. Stores with the capacity of 50,000 to 99,999 square feet are limited to 100 customers per outing. Stores in excess of 100 square feet plus, stores can have up to 400 customers at any given moment. Retail stores, non-grocer, non-pharmaceutical, and non-building supplies, 25% of your occupancy load up to a maximum of 50 feet in any given store at any given moment. Food restaurants, establishments, the new thing is you must close at 8 p.m. Indoor dining facilities are ordered to close. All food must be ordered via the drive-through, curbside, and delivery. For restaurants that are not set up with drive-through or outside payment methods, customers are allowed to pay inside as long as there is no eating allowed inside and no one is violating the 6-foot distancing rule. A citywide curfew is enacted and modified as follows. Under age 18, curfew is between the hours of 7 p.m. until 6 a.m. Unless you are working, you must have on your person a letter on company letterhead stating your name and hours of work. Age 18 and older, the curfew is 9 p.m. to 6 a.m. unless you're working or governed by the Department of Homeland Security, Cybersecurity and Security Agency, or other federal agency. You must have on your person a letter stating your name and hours of work. Visitation, no visitation is going to be for the funeral homes. This is for their services. No public visitation. Only immediate family members and or significant others not to exceed 10. Funeral services, only immediate family members and or significant others up to 10. Graveside funerals, we're saying 25 people, but we must maintain the 6 feet. All funeral services are ordered to implement some type of social distance rule of 6 feet separations for standing and seating. And this one is directly from the governor. Assembling and congregating activities that no business, establishment, corporation, non-profit corporation, or organization shall allow more than 10 persons to be gathered at a single location if such gathering requires persons to stand or to be seated within 6 feet of any person. Once again, I struggle with this. Churches are encouraged to counsel in-house services, to employ social media broadcasting and parking lot services. As I was telling Robert before we came on the air, all our churches done a wonderful job. This weekend, we had approximately 3 that did not adhere. We've already reached out to those churches. Well, 2 of the 3 we've been able to contact, and they have given us their word that they're going to conform to the order.
There have been, speaking of churches, there have been a couple of churches not very far from here whose congregations have been exposed to COVID-19. And if you follow the Southeast Health District's Facebook page, which the Southeast Health District is the umbrella that our health department and Board of Health fall under. They're located out of Waycross, serve 16 counties here in South Georgia. They put up on their website today that anyone who had been to 2 particular churches over in the Pierce County area needed to be very careful and pay attention. I forget exactly how it was worded, but basically, if you had attended a recent service at one of those 2 churches,
correct,
then you had been more than likely been exposed. So the mandate on churches, and again, I think we all have a hard time with that. And I know that when you're used to going to church, even though you know you've been asked not to go when you're not there and you're not sick yourself, it's a little bit difficult to be comfortable doing that. But
correct.
But churches, funerals, those types of gatherings are where a lot of this has already spread.
Correct. And I know we have some cities throughout Georgia that this has been impactful on the funeral services and the church services. Why is this an issue with the funeral services and the churches? Real simple. We're in the South. We shake hands, we hug, we want to provide condolences when we're at the funeral. When I go to church, I hug 50 little old ladies, you know what I mean? But we can't do that. Right now, with us elevating to 10 cases, there's no more shaking hands, no more hugging, no more fist bumps, no more elbow bumps. It's, hey, how you doing from across the room? And we have to practice that. And right now, we do not want what has happened in some cities with churches and funerals, that it can be pinpointed that X number of people are at this funeral, X number of people were at this church service. As Robert said earlier, there are 2 churches that are out there on the website now that Georgia Public Health is trying to get in contact with these citizens and screen these citizens.
One question, we haven't talked about this, so I'm throwing you one that we didn't discuss, but one question I get a lot, and I've gotten a couple of questions today about this with regard to our gyms, fitness centers, health clubs, tanning beds, nail salons, places like that. I know that some are closing, some are not. A lot of the gyms are trying to limit the number of people, again, according to the guidelines. Has there been any discussion about what to do with those types of facilities?
Well, once again, and we have to understand that our leadership team, we tackle these items. And what we decided when we met the first time is we were going to be progressive, we were going to be proactive, but we were not going to be overwhelming. We were going to let the medical data decide what we were going to be doing. Now, can I tell you tonight that we hadn't closed any business? I can tell you that. I can tell you that we hadn't closed any barbershops or salons or weight rooms or tanning beds or anything like that. We're asking you to practice good social distancing, because our next phase could be that we have to close all non-essential businesses. We don't know that because we don't know what the medical data has in store for us in the future. But right now, we're trying to operate and let the economy at least move instead of coming to a